Good evening, all. I am Dr. Nitish Pasale, and today I invite you all to the Pan India's 13th discussion forum meeting on scope of evidence-based nutrition in the management of arthritis. Before starting our discussion, I would like to give you a brief introduction about Pan India, the Physicians Association for Nutrition India. In more than a couple of years now, that Pan India is working in the field of evidence-based nutrition as a part of Pan International. And Pan India aims to educate healthcare professionals about the importance of nutrition in preventing, managing, and reversing chronic diseases, and raise the awareness among general public, and also expand its international network to collaborate with organizations working in the field of nutrition. Our aim and our mission is to integrate nutrition specific interventions into healthcare system in India by empowering healthcare professionals with the tools, techniques, and know how to treat their patients with the help of evidence-based nutrition. Our today's topic is related to arthritis.
We are unable to hear you, Dr. Nitesh.
I can hear.
Even
hello.
we can.
Am I audible now? Hi. Hello.
Yes, sir, you are audible.
Okay. So our today's topic
Pratima,
is,
can you hear now?
I can hear you, but not Dr. Nitesh.
just give me a
Me too.
second.
Yeah, same with me.
Am I audible now? Hello. Pratima, ma'am, am I audible now? Let me turn off my video.
Bhavani, can you hear him now?
Hello. Bhavani, ma'am, can you hear me now?
Now I can hear.
Now you are audible.
Okay. I guess I will have to turn off my video during the session.
Should
okay,
we
so-
restart it again, or because voice is...
No, I think Nitish, now you can turn on your video. I think it should be okay.
Okay, so our today's topic is arthritis and the role of evidence-based nutrition in the management of it. Today, for this topic, we are with 5 questions and 5 panelists. So before beginning the discussion, I would like to request my teammate Deshna ma'am to give a panel introduction. Ma'am, over to you, Deshna ma'am.
Thank you so much, sir. It's my honor. It's my honor to introduce today's panel for the session. Yeah. So today we have Dr. Radha Ramanna Murthy Gokula, sir. He is MD, CMD, Diploma in American Board of Lifestyle Medicine. He's an distinguished physician specializing in geriatrics, family medicine, and lifestyle medicines. With over 2 decades of experience in clinical care, medical education, and research, he serves as an adjunct clinical instructor at the University of Michigan and a clinical associate professor at the University of Toledo, contributing extensively to medical training. As a certified medical director and an advocate for evidence-based geriatric care, Dr. Gokula sir has held leadership roles in multiple healthcare institutions. His research and publication focus on polypharmacy reduction, telemedicine, and long-term care innovations, making him a key thought leader in elderly care and healthcare transformation. Next, we have Dr. Subeta Kannappan ma'am. She is a professor of community medicine at PSGIA MSR, Coimbatore, with a rich academic background, including an MD in community medicine from Sri Ramachandra Institute and a master's in health professions education from Kila University. She is a certified diplomate of the International Board of Lifestyle Medicine and an active member of the Pan India Discussion Forum. With expertise in program management, capacity building for health professions, educator, and lifestyle medicine, she brings valuable insights into public health and medical education. Next, we have Dr. Achyutan Ishwar sir. He is a co-founder of Sampurna Ahara, PHC Lifestyle Clinic and nutritionscience.in. He has a bachelor's degree in naturopathy and yoga science. He is highly motivated to empower people to adopt whole food plant-based diet, enable reversal of disease like hypertension, type 2 diabetes, fertility-related issues, and few others simply by having patients change their lifestyle habits. His PHC lifestyle clinic is open to folks who wish to heal themselves and lead healthier lives. He conducts workshops called Healing with Food and show practical ways of cooking using healthy principles. Sampurna Ahara is a health kitchen that provides whole food plant-based lunches and dinners as a tiffin delivery service and catering. Next, we have Ms. Suprija ma'am. She is a nutritionist and a holistic health coach. She believes that good health is a result of achieving equilibrium in all aspects of lifestyle medicine. She is also a certified sports nutritionist and holds a certificate in music therapy. She is a life member of IDA Mumbai chapter and a member of ISLM. She is founder of Own Your Health, where the focus is to nourish the body and nurture the mind. She is also a nutritional consultant with Sharon. Suprija ma'am is passionate about helping people prevent or reverse lifestyle diseases like obesity, diabetes, PCOS, and believes lifestyle changes should be the first approach and that medication should be the last resort. Next, we have Dr. Miss Ila Patak ma'am. She is a certified nutritionist with a master's degree in dietetics, certified in nutrition and childcare, and also in plant-based nutrition. She is a strong advocate for plant-based lifestyle and incorporates it into her own life. Additionally, she helps people correct their chronic disorders by helping them understand the science behind this lifestyle. Ela ma'am practices at KB Health. We are so grateful to have you all here. So, we will start with the questions for today's discussion forum. The first question is to Dr. Murthy sir. What is arthritis and what are its primary causes? Over to you, sir.
Yeah, good morning. Thank you. And this is morning, 9:30 from the United States. Great to see you all, guys. And thank you for inviting me for this discussion. So to start the discussion, the arthritis, you kind of have to look at it in three ways. One is, I would say, a hormone-mediated osteoarthritis that is very less talked about, and a primary osteoarthritis and a secondary osteoarthritis. And within that, you have genetic causes that cause osteoarthritis, and you have the aging process that causes osteoarthritis. And the primary is usually seen both in male and female, but obviously women tend to present more common. And it's because of a degenerative process, and usually people don't understand where exactly is the problem. But in the secondary, usually there's an identifiable cause. And most of the time, 80%, about in my practice, at least 25% people present and 80% complain of some
Deshna ma'am, hello. Am I audible?
So you can continue, sir. Sorry to disturb.
Okay. So what I'm saying is that so when it comes to the pain, it's mostly only about, even though 80% say they have osteoarthritis, only about 60% complain with pain. And then out of that pain, it's amazing to see that the X-ray findings and the patient complaints have nothing to bear relationship. A lot of times in geriatrics, I see that they get knee replacement and still they're not corrected. So you need to kind of do a total examination, whether if it is hormone mediated, then you kind of address the hormones, because estrogen, especially in the postmenopausal or in the woman, in the men after andropause, which is not much talked about, do have an effect on the subchondral cartilage and the sclerosis most commonly seen. So arthritis is nothing but a degenerative process or a hormone-mediated process, or due to aging or a genetic process. And I kind of gave you the primary causes. But what, from a clinical standpoint, what's important is to kind of understand what exactly happens around. It's not, if it's bone on bone, doesn't mean that it causes problems. You often have to kind of look at the spine, and you also have to look at the leg length. You have to look at the arch supports, the arches of the leg. And once you correct all of those, then sometimes you can get by. And in my practice, I'm kind of family physician, geriatric specialist, but now I'm into a second avatar called lifestyle and anti-aging medicine. And the arthritis that we see, some of the causes that you can really take care of is by the mechanics that can be adjusted, and you can fix the primary cause, whether if it is scoliosis or if it is you have leg length issues or you have bow legs, then one side of the compartment goes wrong, and that either can be medial compartment or lateral compartment. So these are some of the primary causes you just have to focus and pay attention to based on how you look at the causes. So do you want me to go into more discussion or stick to my question?
So thank you so much, sir. I think it will be nice if you stick to your question. Thank you. Dr. Suvaita, ma'am, do you want to add anything on this?
No. Nothing to add. Thank you so much for asking.
Thank you so
Just
much,
had a
sir.
question, Deshna. What about Dr. Murthy, the other forms of arthritis, like primarily, like rheumatoid arthritis and psoriatic arthritis and those kind of things? Would that
Oh,
not?
absolutely. Though, I mean, if you want me to address, they're the autoimmune causes, and what Supraja is alluding to is the inflammatory arthritis. Then there is the infectious causes of arthritis, wherein if you have, in India, it's very common, the rheumatic fever, then you have a fleeting polyarthralgia, and then the rheumatoid arthritis is an immune-mediated arthritis, and lupus, all the immune mediated, they all affect the joint. Those are the secondary causes, basically, that I kind of clubbed in based on either inflammation or infection or autoimmune causes, or whether it is some nowadays when arthritis, the gut dysfunction also has a role to play, and you got to kind of address all those things. But predominantly, it's a inflammatory degenerative process. So based on which joint, basically you can say that osteoarthritis affects usually the large joints, and it is a symmetric process, bilateral. And if, for example, in just the finger, if you look at this joint, osteoarthritis gets affected. If, like psoriasis, you get this joint affected, the rheumatoid arthritis, sorry, and then psoriasis, the PIP joint. So you can say based on which joint is predominantly affected. But like for rheumatoid arthritis, patients usually get up in the morning, they are swelling in the joints, and then they have stiffness. And then when you have psoriatic arthritis, usually you think that they should have psoriasis. It's not the cause. It's not the case. Sometimes you may not have the rash, but you have, and then there are other autoimmune like ankylosing spondylitis, and each like spine has a separate way how it presents as far as the primary causes are. But usually the pain is what brings people to attention. And it'll be amazing to see some of the pain is based on the tendons, how they get inserted. And if you address all these mechanical factors, you can address most of the causes. But the bottom line is you got to address the primary cause. If it's infection, you treat the infection, the arthritis gets better. If you treat the autoimmune cause, then the arthritis gets better. But if it's a hormone mediated, then you address the hormone. If it's genetics, obviously some of the nutritional factors that we can talk about which is specific. The other panelists may throw more light on it. But from my standpoint, some of the things I can actually, if there is a treatment, I can tell what I do. I never give steroid injections to an arthritis patient anymore. I do what is called regenerative medicine. So I can talk about, we call that prolotherapy, or we do that platelet-rich plasma or stem cells or peptides, and that's how you manage the pain and and you regenerate basically the tissues that have been degenerated within the joint. I'm not saying everybody is an ideal candidate, but fixing the primary cause and trying to address the different kinds arthritis with the underlying cause will help. Toxins are another cause for arthritis, and then I think that's also very important to address.
Thank you so much, sir. Thank you. Now, next.
Yeah, please.
Nitesh sir, we cannot hear you clearly. I'll take the next question. Maybe next question.
Yeah, ma'am, please.
So my next question is to Ila Pathak ma'am. The question is, in terms of inflammation, how various dietary patterns play a role in arthritis management? Over to you, ma'am.
Thank you, Deshna. Good evening, everyone. As Dr. Murthy pointed out, there are various causative reasons for arthritis, but basically the arthritis thrives in an acidic environment. And if the body is too acidic, it actually becomes conducive to inflammation. So chronic inflammation is basically a major causative factor for arthritis. And the number one reason for chronic inflammation in the body is poor dietary choices. Yes, food is medicine, but wrong foods can actually lead to inflammation in the body. And many people are not even aware that they are consuming foods which is in fact causing inflammation in their body. So I would like to point out a few foods which are very, very inflammatory. The number one is sugar, be it white sugar, brown sugar, or high fructose corn syrup, or sugar alcohols, which actually we consume in the form of foods when we eat processed or packaged foods, fast foods. They are going into our body, and sugar is highly inflammatory. As I said earlier, the processed and the fast foods, which has become the staple of the young generation nowadays, are foods which have been actually modified from the form in which they are available in the nature. So they are completely modified and are extremely inflammatory. Then is dairy. The protein which is found in dairy, casein, is known to trigger the antibody reaction and lead to autoimmune disorders like the psoriatic arthritis or the rheumatoid arthritis. Then is wheat, the gluten in the wheat. The wheat which we are consuming nowadays has been modified. The crossbreeding happened somewhere in 1950s, and a very, very strong protein in the form of gluten has been evolved, and this protein, the gluten inefficiency also. So if someone is deficient in vitamin D or good omega-3s, omega-3 fatty acids, then also the inflammation happens. We are nowadays consuming a lot of vegetable oils which are rich in omega-6 fatty acids, and the ratio of omega-3 and omega-6 fatty acids is actually going haywire, because of which there is inflammation in the body. Then we don't get enough vitamin D, which is a sunshine vitamin, and hence we are seeing a rise in the inflammation in the body. So what needs to be done is we need to make the environment in the body more alkaline. So the blood pH more or less remains same because the liver, lungs, and the kidneys are working to make the pH of the blood remain where it should be. But the cellular pH is actually tilting towards tilting more towards acidic, and this can be controlled by food, by having alkaline foods, which are basically all kinds of colored, non-starchy vegetables are very good and anti-inflammatory foods because each colored vegetable has an antioxidant in it. Fruits also, all fruits are anti-inflammatory. Some cereals and grains like millets are alkaline. Wheat, as I mentioned, is acidic. Quinoa is alkaline. Then nuts and seeds. Some of the nuts are acid producing, but Brazil nuts, almonds are basically alkaline. Then lemon. Lemon is the most alkalizing food, and it is acidic where it should be in the stomach, as it needs to digest the meal which we eat, and it is alkaline once it is metabolized. So lemon is a very good alkaline food to have. Then we should have good sources of protein, which are almonds and seeds, nuts and seeds, and beans, whole beans, legumes, and lentils. Then we should have good sources of omega-3, which is basically a tablespoon of either chia seeds or flax seeds, walnut halves, or hemp seeds. So all these foods are actually helping us create an alkaline environment in the body, and ultimately helps to fight the inflammation. The whole food plant-based also provide the fiber which is needed for our gut bacteria. It increases the diversity of bacteria in our gut and maintains a good colonic pH, which also helps fight inflammation.
Thank you so much,
That's all from me.
ma'am. Achyutan sir, do you want to add anything on this?
You want me to add a little bit?
Sure, sir.
I mean, since we're talking about evidence-based, I think Mediterranean diet needs to be, as she gave a very great explanation, but Mediterranean diet in particular, olive oil and polyphenol compounds, they actually help with cartilage degradation. There was a meta-analysis that was done, and you have seen like strawberries, curcumin, and ginger. They have the anti-inflammatory properties. And omega-3 but vitamin D also needs to, because it helps with mitigation of OA progression. And the important thing that people forget is the physical activity that brings along with the diet for enhancing the cartilage recovery and reducing the inflammation. In the past, they used to say rest the joint, but now you got to move the joint. So I just wanted to show that some of the, obviously they were talking about vegan, but the important thing is to kind of talk about the Mediterranean diet and the strawberries, curcumin, and ginger based on evidence, plus the omega-3 fatty acids and vitamin D.
Thank you so much, sir. My next question is to Dr. Suvita, ma'am. Considering the vast number of supplements marketed for arthritis, how can clinicians determine which evidence-based interventions are truly beneficial for their patients? Over to you, ma'am.
Good evening, all. Thank you for inviting me to be part of this forum. And I think arthritis is one non-communicable disease condition which is considered when we talk about non-communicable diseases and a lifestyle modification for non-communicable diseases. I think this is one condition which is most neglected. And one point which we need to really look into is among all the causes of arthritis, Dr. Murthy also highlighted, I think autoimmune conditions, the arthritis is one of the common manifestations in autoimmune conditions, especially women are prone for autoimmune conditions, with arthritis being one predominant symptom. So there is a lot, and supplements are one of the key therapies which patients want, and clinicians also are deemed to give to patients when they come with arthritis, be it osteoarthritis or any other autoimmune conditions. So we need to look into a few things which are very important before clinicians subject the patients to supplements, because with the current access to social media and information, patients come with more information than us. So the first thing which need to prioritize is the scientific evidence. As Dr. Murthy was saying, he was pointing out to a meta-analysis, right? So systemic review and meta-analysis being the topmost so evidence. So you need to look for evidence from systematic review and meta-analysis. The second thing is, if we don't have evidence from the systematic reviews, look for any other randomized control trials which would give evidence for a particular supplement being useful. The next important thing which we need to consider is whether this supplement has any biological plausible mechanism, meaning what is the path of how it reduces the symptoms or reduces the severity of the disease. So we need to look into the biological plausibility. That is the second important thing which we need to look into. The third thing is, while a lot of almost all drugs come under the FDA regulations, most of the supplements are not regulated. So there's a standard of these supplements also have to be looked into. And then the last the most important thing is to look into the risk benefit analysis, like in terms of the side effects, the drug interactions, because especially if it is going to be autoimmune, patients may already be on multiple drugs, and we need to look into the drug interaction, and then also cost. So with these four important things being in the background, I think there is some strong evidence available for the role of glucosamine and chondroitin, especially I think for mild arthritis, but it's less for the moderate to severe osteoarthritis. And I think the role of diet in reducing the symptoms and also the severity of the disease has been well described. And again, the re-emphasis is on diet, but there are, especially I think curcumin was discussed, there are curcumin extracts available, and it acts through inhibition of the COX2 and beta pathways. So this is the route in which it reduces the inflammation. So some meta-analysis shows that there is a moderate little bit of pain relief compared to NSAIDs while using curcumin extract. So and then omega-3 fatty acids, which was discussed, as in rheumatoid arthritis, it has a role in reducing the joint stiffness, and so this is supported by some studies. And vitamin D deficiency, so we need all patients have to be the vitamin D levels have to be looked into, and vitamin D deficiency increases the risk of arthritis. So apart from role of some our grains, having some sources apart from sunlight, we need to give vitamin D supplementation if there is a deficiency, which may reduce the severity. So other supplements like collagen peptides, and when most of the others do not have enough, or they have a conflicting evidence on usefulness in arthritis. And to conclude, what we need to look into is always look for the strongest evidence, and don't have a one size fits all approach. Look for the individual, so go for an individualized approach. And always the role, as Dr. Murthy and Dr. Ilas said, there is a role of lifestyle modification, including weight management, physical activity, and dietary modification. So that being the forefront, I think the supplements take the next stage. Thank you.
Suveta ma'am, if I may just ask, sorry,
Yeah.
what about vitamin K? Do you recommend vitamin K supplementation or something like that in arthritis?
To my knowledge, I mean, I'm not sure. So I think Dr. Murthy can add to it. I'm not sure about the role of vitamin K, because vitamin D, yes, definitely we need to look into that. But I'm not very sure about it. Sir, can you just add about it if you have any ideas?
Happy to add that.
Thank you.
Vitamin D can be absorbed better when there is vitamin K2, and that plays significant role in osteoporosis or osteopenia. And vitamin K has no role in management of osteoarthritis. But if you may allow, I just can give you a summary of all the meta-analysis and systematic reviews published with glucosamine and chondroitin. Mostly it's a moderate evidence, but clinical significance is always debated with patient. I dealt with geriatrics for 20 years, and you'll see everybody. And somebody has nicely said that none of these supplements are FDA approved, so nobody knows whether you're getting the right one. And chondroitin, you actually have to go to very, very deep seas to get the right chondroitin, and it's extremely expensive. So God alone knows what chondroitin you're getting. So Canadians have done studies and mild glucosamine. That's why I don't like to spend people. But if you look at 69 studies like collagen hydroxylate, curcumin, boswellia, pycnogenol, L-carnitine, they all have a large effect on pain for a short time. But omega-3 fatty acids really help with pain relief and functional improvement based on all the meta-analysis. 9 randomized controlled trials, actually. And then as far as nutritional supplements, basically you have variety, and they just help with pain intensity and physical functioning in both knee and hip OA. But I want to kind of put this across. Eggshell membrane has promising evidence supporting its use as a supplement for knee osteoarthritis management. There was a systematic review and meta-analysis just published in 2024. And vitamin D actually helps with pain, especially in patients with deficiency. And for me, being a lifestyle anti-aging guy, I keep my vitamin D at 80. That's where most of the outcomes, and this was based on a meta-analysis of impact of nutritional interventions on osteoarthritis in 2022. So, I mean, glucosamine is good, but chondroitin, see the source, but MSM, methylsulfonamic, and omega-3 fatty acids as nutrition is the better source that way. And curcumin, boswellia, collagen, and eggshell membrane, and vitamin D would be the ones to discuss most. Thank you. And then somebody asked about tomatoes, Meena. Meena asked about tomatoes. It's kind of funny. In functional medicine, they talk about Solanaceae family. I don't know, we have a lot of nutritionists, Supraja can highlight, but Solanaceae family, all the brinjal family. So tomatoes come under brinjal family. This doctor cured his OA because by avoiding Solanaceae, but I don't know if it really panned out well.
Thank you so much. My next question is to Supraja ma'am. What role does the gut microbiome play in the development or management of inflammatory arthritis? And how can nutrition help modulate this? Over to you, ma'am.
Yeah, thank you, Deshna. Good evening, everybody. So we all know the gut-brain connection, and the microbiome is being spoken about, like, especially in the recent few years. There's just so much more evidence that's coming out on the role that our microbiome plays in overall health, right? And it's the same case with arthritis also. Whether you talk about OA or RA or any other form of inflammation that's happening in the body. All the food that is eaten is broken down in the gut, right? And the bacteria and other microorganisms in the gut, which constitute the microbiome, is the key factor in breaking down this food. Now, this food is transported through various mechanisms into the bloodstream, and obviously the nutrition is provided to the cell. Now, there is a thin barrier which delineates the gut from the rest of the body, right? Which is kind of semi-permeable. So it allows the nutrients to kind of come into the gut, but it does not allow the toxins to go out. Now, with this barrier is something which acts like a protective layer, right? And it is this barrier which functions, which allow, which when there's inflammation, something that Ela spoke about, right? Inflammatory foods. So when there's a lot of inflammatory foods that come into the body, some parts of this barrier could get damaged. And this leads to, the nutrients that go into the bloodstream. Along with that, a lot of toxic microorganisms can also enter into the bloodstream. And some of these toxins could mimic joint tissues, right? Some of these bacteria could mimic joint tissues, and then they go and settle in the areas where, the joints are there, and that could lead to inflammation. So having a very healthy gut microbiota is very important, because inflammation has to be controlled, right? We all know, and Dr. Murthy has spoken about this, that chronic low-grade inflammation leads to predominantly osteoarthritic condition, while it is degenerative and while it is, age related and all of that, but inflammation adds to the whole problem. The second thing, when it comes to the gut microbiome is the beneficial gut bacteria, right? So when food is broken down, and we get a lot of the short chain fatty acids, and we've already spoken about the role of short chain fatty acids. So short chain fatty acids, they kind of provide a anti-inflammatory effect, right? So things like butyrate and all of these are very, very anti-inflammatory. And when you have a good number of bacteria which help in the production of short chain fatty acids, your inflammation is kept at a minimum, and therefore there is improvement in the overall inflammatory condition, and therefore there is a significant improvement in pain and other symptoms related to arthritis. So definitely the role of the gut microbiome is very, very significant. Now, as far as nutrition comes into picture, Ela has already covered a lot of the foods that need to be consumed, so how do we ensure that we have a diversity of bacteria? And for this, these two terms again has become very popular in the recent past. That's prebiotics and probiotics, right? So prebiotics is the fiber that is found only in whole plant foods, right? And by consuming a variety of whole plant-based foods, you're bringing in good prebiotic into the gut, which helps in the development of, the healthy gut bacteria. And a balance of the healthy gut bacteria kind of keeps the unhealthy bacteria at bay. So you don't allow the inflammation to come in, and you don't allow the infections to happen. The second thing is probiotics. Now, probiotics again play a very critical role, but we focus more, I think, when it comes to inflammation, the focus should be more on prebiotics, which is predominantly found in, the whole foods, because there was also the talk of omega-3, right? Omega-3 fatty acids. Again, these are very critical when it comes to reducing inflammation in the body. And Ela has already covered the balance of, omega-6 and omega-3, how we need to make sure that we maintain that balance of omega-3s and omega-6. From a nutrition standpoint, I think it's very, very important to cover, to make sure that we get in a variety of fruits and vegetables. They're very, very alkaline. They come with fiber. So, both the inflammatory, anti-inflammatory things are taken care of. Also bringing in a diversity in the form of proteins, right? Plant-based proteins are more beneficial in reducing inflammation compared to animal-based proteins. So staying off meats, highly processed foods, and oils, refined oils, again something Ela has already covered. So that is something, again, avoidance of those foods definitely helps the gut microbiome, and it helps the overall inflammatory condition. And the third thing, which Dr. Murthy happened to mention, some of the polyphenols and anti-inflammatory properties kind of help in the reduction of inflammation. One other important point, which Ela did mention, something that I do just want to touch upon, is gluten. And there have been many instances where, and of course, there have been evidence also, just avoiding gluten can reduce inflammation, and that could be like because of the modification of the kind of food that we're eating. So probably if you want to look at an alternative to wheat, then probably going back to our traditional emmer wheat is a little more beneficial, or it's a little less inflammatory compared to the normal wheat that is available in the market, which has got more gluten. Not to say that emmer wheat doesn't have gluten, but the percentage of gluten is very relatively very small. So if gluten doesn't bother you too much, it would still be a good idea to stay off gluten for some time and see how your symptoms resolve, or how it's helping you in improvement of the inflammation, or rather reduction of the inflammation. And but if you do feel you need a substitute, then you might want to look at emmer wheat as an option, which is more beneficial. And the other things have already been spoken about, vitamin D, avoiding processed foods, junk food, fast food. So definitely maintaining a healthy gut microbiome is very, very critical. It's not just important, it's actually critical in the management of inflammatory arthritis. Yeah.
Thank you so much, ma'am. Ila, ma'am, do you want to add anything on this?
Just a small bit. So when the diet is lacking in fiber, as Supraja mentioned, it leads to decrease in the production of SCFAs, which are short chain fatty acids, and increase in secondary bile acids, which actually increase the permeability of the gut lining, leading to a leaky gut. And secondly, diets which are high in saturated fats, they also have the same process, and they allow inflammatory substances such as the bacteria and lipopolysaccharides, which are the bacterial endotoxins, to pass through the lining and enter the blood, causing inflammation.
Yeah, thank you for that, Ela. I missed out the saturated fats, foods high in saturated fats. Yeah.
Yeah, let me add from the functional medicine standpoint, some of the bacterial species that are pro-inflammatory are Shigella flexneri, because Shigella is common in India, Streptococcus is common, and Proteobacteria. When you do gut microbiome analysis, you can see this. These are pro-inflammatory species. And some of the reduced anti-inflammatory species these are beneficial bacteria, like Bifidobacterium, Bacteroides. So Lactobacillus, Acidophilus, these are all very good. And anything that changes the tryptophan derivatives with the microbial metabolites have shown with gut related. And there are now clinical trials actually investigating microbiota targeted therapies. Like what they do is they actually give you these species like Lactobacillus casei shirota. They have shown to reduce pain and inflammation. This was a meta-analysis of clinical studies. And after 12 weeks, they've seen improved pain and reduced CRP levels. Prebiotics have been talked about, and fecal microbiota transplantation has shown in the preclinical models, but not. So there's a lot of research with Bifidobacterium, also species going on. But the diet, as people have talked about here, high fiber, pro-inflammatory food. I mean, I commonly say processed food, sugars, animal products, dairy, refined flours, and gluten as the 6 things, to kind of just stay away in general, plus all the other things that my great panel members have elucidated.
Thank you so much. My next question is to Dr. Achyutan Ishwar sir. The question is, how can healthcare providers effectively integrate evidence-based nutrition guidelines into the routine management of arthritis patients? Over to you, sir.
Thank you so much, Teshna, and so wonderful to hear everything everyone said. I think you covered all the points. It was like a whole revision of everything I have read and listened and discussed about arthritis. Thank you so much for sharing. I think when I started my practice and started telling. I think the first patient I had with arthritis was my grandmom when I was back in college, and she was in the beginning one of the most difficult patients, but then she changed over time. I think the main problem I had was I would read about these amazing mechanisms in my medical textbooks, in the medical journals, in the medical papers, while talking to doctors, and my mind will be buzzing with this new information, and it feels, wow, this is going to be life-changing for my patient. But then when I try to explain it to my patient, within like half a sentence, they zone out. They're no longer listening to me. They have no clue what I'm talking about. So I have to break it down. I have to make it simple. You read a medical paper at one level of a language, but then when you talk to a patient to inspire them to make that change, the communication has to be completely different in a language that they understand, using examples that they understand, using metaphors that they understand, and with simple tips and tricks which they can actually implement in their daily life. Like, for example, saying the saturated fats, the omega-3, omega-6, the fact that rheumatoid arthritis is an autoimmune condition. All of these, yeah, they'll hear you, but then it's not going to stay back. But at the same time, if you tell them, look at your plate has to have half plate fruits and veggies, and the other half plate can have cooked food. That's something that's very simple. People are going to remember it, as an example. So as a lifestyle physician, when you're guiding patients about diet and lifestyle changes to reverse arthritis, I focus on, let me share what I do. I'm a full-time lifestyle physician who does this, all day. I don't talk about medications. I don't take exercise classes, yoga classes, none of those. I full-time focus on nutrition. So I go a little deeper than normal into this. Okay. So what I do is I take them on a step-by-step journey. We put out a 1 month, 3 month, 6 month, 1 year treatment plan, depending on how much support the person needs. And every time I talk to them, I give them one small set of changes to make, bite-sized changes. We don't go for, here's a diet chart to follow. I've almost never done that. Instead of that, I give them habits to build, saying, okay, for the next 1 week, for the next 2 weeks, we're going to work on this habit. What habit is that? Depends on the person. We start with adding more healthy foods into your diet. Eat more fruits, eat more veggies, eat more salads, eat more greens, eat more cruciferous vegetables, eat more nuts and seeds. Eat more whole grains. Try out these 3 different whole grains. Here are 10 recipes. I want you to make these recipes at home. Try it out. See which one you like the best. Okay. Look at your plate. What does your plate have? Send me photos of your plate. And every time you get a photo, you share feedback. I see these 3 things. This is fantastic. Have you tried this one thing? Like last week, a patient shared a photo of their plate. It had, I think, apples and oranges, pomegranate. It had a salad, all of which was fantastic. And then there was paneer gravy with a roasted, like fried fish. So I said, your left half of the plate looks fantastic. Have you tried tofu? Have you tried using yam instead of fish? Have you tried using cashew butter instead of dairy butter? Here's a recipe to try. Order tofu from this link. And yam is a fantastic replacement for fish. Try it out and see. Otherwise, go for a mock meat alternative. These practical tips. So giving them small steps at a time, giving them easy steps first, and then more difficult things a little bit later, and focusing on one thing, creating one habit, building one habit, and then moving on to the next habit. All of these approaches are things that have been found to work. Another thing that works is to combine an individual approach with a group approach. If you have a patient that you're guiding to adopt a healthier lifestyle, doing one-on-one sessions really helps them get their doubts answered and understand exactly what to do, why to do it. But the motivation to do it doesn't come because you're not there with them every day. You're not in their house. Okay. And that can come when you're in a group setting. For example, we have a WhatsApp group with a whole bunch of people who are all on our treatment plans. And every day, whoever is an active participant shares a photo of their plate. So then you have that peer pressure. No, usually peer pressure is negative because it gets you into drugs and alcohol and smoking and whatnot. But here we have positive peer pressure because you see, oh, that guy's eating a salad. Oh, that person's eating a fruit. Oh, they're trying brown rice. Hey, they got whole wheat bread. Oh, they're eating out, but still they ordered a salad. And then, okay, let me also do it. So that positive peer pressure helps a lot, and it's motivating, it's inspiring to do it. So those are things that you can do, approaches where you can get people to adopt a healthier lifestyle when you're doing it full time. Now, if you're not doing it full time, if you're doing, let's say you are having a regular practice, plus you want your patient to make these changes, then there are a few other approaches you can try. One is give them an information booklet or a video or an online course or a YouTube video or a resource which they can follow at home. Okay. Another one of the things we do is we give our patients access to all our online courses on nutritionscience.in. There are like 250 recipes, more than 100 videos that people can watch. So even though they're talking with me for 1 hour, they may be watching the videos for 10 hours. So they learn a whole lot. Okay. Because as a doctor sitting in a clinic or a hospital doing a consultation, you don't have time. How many patients can you see? You have 20 patients sitting outside. You can't spend an hour with each one. It's simply impossible. Okay. So when you're in that situation, give them access to resources which they can use. We have a whole bunch of free courses on nutritionscience.in. PAN has free resources that they can access. And there are so many whole food plant-based resources online. You can make your own resource if you like. Reach out to PAN, reach out to me, reach out to other experts if you need help. Create your own ebook, or an ebook of recipes, like 10 recipes and one small intro, or make one video about arthritis and plant-based diets. Share that with your patients. There was a study done by Dr. Alison Menezes where she said, look, I'm a doctor. I don't have time to talk to patients. I want them to go plant-based, but I just don't have time to do it. So I'm going to spend 2 minutes talking to people and telling them to try plant-based, only 2 minutes. And let's do a study out of it. So she actually did a study called Take 2 Minutes for Plants. Okay. And the study found that 80% of people, 80% of patients, I think 70 to 80, something in that range, actually shifted their diet and started eating healthier, and they continued it for the next 2 years. So that's all it takes. It's like, take 2 minutes to tell patients, rather than thinking, oh, are they going to change? I don't know if they're really going to change or not. Okay, that's secondary. Whether they change or not is secondary. But my duty as a doctor is to give my patient the information, give them the inspiration and the motivation, and then leave it up to them to actually make that change. Okay, so tell your patients about it, even if it's just for 2 minutes. Okay, and the third thing that you can do is take the support. Like if you say you don't have time at all, you only have 1 or 2 minutes and you don't have time to make resources, you still want your patients to make that change, take support. There are so many wonderful people in this community. There's Supraja and Ila and so many others who will be happy to support you. You can form a collaborative partnership. You can refer patients. You can use resources that are common, and there are so many experts in Pan India. Pan India experts in Pan India who will be happy to support you and help your patients and spend time with your patients and help them to actually make that change happen practically. Getting your patients to go plant-based is difficult. At the same time, there are systems, there are people, there are resources, there are so many ways in which you can make it successful. And I think it's so crucial, it's so important, because it's one thing that can completely transform their lives, and not just to reduce their joint pain, but to give them more energy, to give them positivity, to give them hope, to reduce their risk of other diseases, improve their lifespan, increase their longevity, increase their quality of life, and just make you feel wonderful. Yeah. And at the end of the day, I tell my patients, look, why did you come to me? You didn't come to me because you want to reduce your pain. You came to me because you want to be healthy, which includes reducing your pain. Why do you want to be healthy? Because healthy people have more fun. So focus on that. Make it fun for yourself. When you make something fun, that becomes sustainable. You're able to follow it for longer. So that's my 2 cents. Thank you for listening.
Thank you so much, sir. Supraja ma'am, do you want to add anything on this?
Yeah, I mean, just a couple of points. So the way I approach it is, I obviously look at, the blood markers, simply because, how much of inflammation in the body is something that your blood markers can tell you. And also the supplementation, which we've already spoken about. So these are two things that I will look at before getting into the actual nutritional part of it. And I look at where the patient is currently at, right? I mean, and like Dr. Achyutan said very clearly, you can't just expect them to do everything overnight. You have to do micro habit building kind of a thing. So whatever is their current practice, how do I change that one step at a time? Now, as a nutritionist, I do have the time to do that. But most clinicians don't have that kind of time. But it is important to at least address the root cause of the problem. See, a lot of osteoarthritic patients are obese or they have overweight, right? Now that adds to your problem of joints not being able to support you and all of that. So addressing whatever could be the cause, right? In an autoimmune condition, it could be something else. It is obviously your immune system malfunctioning. But so some of these things, I think, empowering the patient with a little bit of knowledge, even if it's just taking 2 minutes, but saying like, okay, look, you're overweight. So you need to lose weight. And how do you lose weight? You lose weight by bringing in more fiber into your diet. You cut out the fat. So some small changes that can be brought in. And very important, I think, for clinicians to take the help, because they don't have the time. So to take the help of other allied partners. So tracking, monitoring is one of the critical aspects, again, when you're talking about management of patients, right? So how tracking whether they are able to follow the changes, tracking whether the food that they're eating, is it palatable, uh, so all of these are in aspects which needed to be included in the routine management. Also, Dr. Achyutan very beautifully put it, having a support system is very, very essential, because trying to make changes on their own is sometimes most often can be very overwhelming. So having a support system, it could be bringing the family on board and telling them again, look, this is critical because this will lead to this, empowering that information. And second is, like Dr. Achyutan said, having a community of like-minded people or people who are on a similar journey, that really, really is beneficial. Yeah.
Thank you so much. Over to you, Dr. Nitesh sir.
Hey, Deshna, one thing I didn't see people talk about, we are all lifestyle medicine people. I wish we could have ended this from Dr. Achyutan, what he started, with SMART goals and fit prescriptions, because every day he does that on a daily basis. I just thought, kind of giving the SMART goals for nutrition, and then increase anti-inflammatory foods, laying them down like specific, measurable, and as you all know, and then the frequency, intensity, time, and type. I mean, those prescriptions are really critical to spread the charm. I call that the charm of lifestyle medicine, wherein people come to me as a doctor asking for my prescription. So these are what I kind of made a one-page SMART goals, fit prescriptions. Usually I have them as a real prescription. And that's what actually happens if you go to the Institute of Lifestyle Medicine in Harvard, in Beth Israel. They have fit prescriptions for every domain of lifestyle, the 6 pillars, and they have SMART goals prescription, and the doctor signs it and all that with specific prescriptions. Just wanted to throw that at the end.
Thank you so much, sir.
Thank you so much, sir.
Not Dr. Achyutan. I ate his food. I actually ordered it and got it to Vijayawada, and my sister mailed, and great work. Supraja, I met. I mean, you guys are awesome. And Regina, I mean, excellent work for India.
Thank you so much, sir. Deshna ma'am, should I start?
Yes, sure, sir. Sure, sir.
Okay. So in the beginning, Dr. Murthy sir explained what is arthritis exceptionally well, both in a simplified manner and with a great sophistication. And then Dr. Ila Patak ma'am explained how an acidic cellular environment can contribute to chronic inflammation worsening arthritis. And evidence-based nutrition supports alkaline-rich diets like millets, nuts, antioxidant-rich fruits, and veggies to help reduce inflammation and improve joint health. While considering the supplements, clinicians should look for researches conducted in the subject like systemic reviews and meta-analysis, RCTs for promising evidences, and supplements. Through this, there are some evidences that suggest the supplements like vitamin D, chondroitin sulfates, and curcumin extracts, along with healthy dietary patterns and physical activities, can help in the management of arthritis. Then the gut microbiota influence immune responses, and dysbiosis can contribute to inflammatory arthritis. Modulating gut health through evidence-based nutrition like fiber-rich diet and whole foods and omega-3 rich foods may help reduce inflammation and improve disease management. Then always try to address the root cause of the problem, because in this uh, for looking this root cause, we can look into the lab reports, and monitoring patients' behavior could be an effective strategy. And while empowering our clients, we should use the language that our clients can understand, like giving them familiar examples. We can use step-by-step approach for their benefits, instead of trying to change everything to start with. Then building one habit and moving to adopt the new one can help. Also, group session can also be a helpful motivation for individual patients. And also providing resources can definitely help to change and stick with behavior that could help in eating healthier diets. And finally, taking support from peers working into the field of nutrition can often help your patient and also to the practitioners. So finally, the inclusion of SMART goals and fit prescription is the key. Thank you. Now, before closing the session, I would like to take a question from our audiences if they have any. They can ask their question to the panelists directly by unmuting themselves, or they can put their questions into the chat box. Thank you.
Hello. Yeah, this is a question for Ila Patak, madam. She said sugars are very highly inflammatory. So what about high sugar containing fruits? Should they be avoided, or they are okay?
Yeah, by sugar, I mean the crystalline sugar or the brown sugar, uh, which is produced in which is basically a extract of the sugarcane juice. High sugar fruits can be eaten because you are eating them whole and they have fiber in them. So avoid eating in the second half of the day. But of course, high fruit sugars are not can be eaten. They are also alkaline.
What about jaggery?
Jaggery is also same. It is also acidic only, because it is a one step before the sugar, but ultimately the process of making the jaggery is same. You are extracting and the sugarcane juice and converting it into jaggery, and the next step is sugar. So jaggery and crystalline sugar both are acidic foods.
Yeah, thank you.
Hey, can I ask a question? Because I have so many nutritionists. You know, this sugar thing, my daily consumption in the morning is in black coffee, a little honey, but my functional medicine people don't agree with that of honey. And especially now the Ayurvedic people say you can't put honey in hot stuff. So if you want something, the functional medicine says stevia and all that, conflicting. But let me hear from the nutritionist. What can I do to add some sweet thing to my black coffee?
The caffeine itself is acidic. So yeah, I wouldn't suggest taking caffeine in the morning, because it is a stimulant and it is acidic. Itself is acidic.
But if
Okay.
you want to have, you can try adding, since you have it black, you can add date paste, or Dr. Achyutan recommends blackstrap molasses.
What is that? What is that? Blackstrap molasses? And what else?
Yeah, it's blackstrap molasses. Or date paste.
Date paste.
Date syrup, those work well because they come with the fiber and they are, you know, I mean, since we here have spoken about meeting the patient where they're at, so Dr. Murthy, getting you to keep your coffee, but make it a little more healthier.
Yeah, yeah. Okay, date syrup. I'll try the black syrup, molasses, and date syrup and see. I got the date sugar, but it turns out to be very ugly by the time the sugar dissolves in the black coffee. So I need to get away from honey. So thank you, thank you. So even I know the guy who makes the honey because I go to his beehive. You know, he has, even then honey is bad in the hot. Ayurvedic people say, no, nothing in hot you can put honey.
Again, very simply put, honey doesn't have fiber. So when we're talking about alkaline foods, honey definitely doesn't come in that category. I don't know much about Ayurveda, so I would not comment on that. But also, honey is concentrated glucose, right? Like it's highly. I mean, I would put it in the inflammatory category. I don't know what Ayurveda does.
Okay, thank you.
I think here the glycemic load is the main problem.
Yeah, that's true.
Yeah.
Thank you.
There's one question regarding the gut microbiome. There was a report suggesting that Prevotella bacteria in the gut causes arthritis, or excess of Prevotella bacteria in the gut microbiome causes arthritis. So, and Prevotella, I believe, is produced more because of eating more vegetables and fruits. So, isn't that doesn't it go against what we have been saying?
I don't know. Anybody else want to take, or you want me to take that?
Sir, you can take.
Yeah, I mean, I've fixed a lot of guts based on one bacteria, and the microbiome keeps changing as we speak every second, the gut microbiome. So emphasizing specific, the Brevitella has not been really shown consistently in all studies, but what has been shown is the lactobacillus species based on the meta-analysis. So the risk benefit of one particular species with trying to link to certain things with trying to kind of what actually the butyrate that's produced by eating whole food plant-based diet completely boils down any of the individual specific microbiota. So still the benefit of eating plant-based whole food, high fiber, polyphenols, Mediterranean, these outweigh trying to just focus on microbiota assisted therapy for osteoarthritis. So I would not pay attention to just one Prevotella and inflammation. You need to look at the whole picture.
Sir, here I'm talking more about inflammatory autoimmune type of arthritis. Does it hold true for that also?
No, I mean, that's why I said, you know, fecal transplants, when they do that, they just don't do one thing they just do a specific set of species to help the overall inflammation rather than one thing, you know. So while most have not been, at least based on the gut functional medicine people, the species that I've said are associated with actually reducing pain, the good microbiome. But if you look at the Prevotella inflammation versus trying to eat this outweighs, even in autoimmune issues and all that stuff. I have just reduced all the 6 things, and then suddenly everything gets better. Their CRPs get better, their IL-6 get better. But trying to just focus on one particular species with autoimmune arthritis still doesn't weigh the benefit versus risk. No, so you're better off trying to treat the whole person as a whole rather than one thing for autoimmune or things like that. So actually, Harvard has a wonderful anti-inflammatory diet. You know, a whole series that talks just about anti-inflammatory diet. That's what I give for all my autoimmune patients.
Sir, are pulses advisable for a patient of osteoarthritis? Hello.
Hello, what's the question?
Pulses are advisable for osteoarthritis patient.
Absolutely. I mean, there is one set of people who say the lectins in the pulses cause inflammation and all, but it's not everybody, or the lignins or lectins. But if you take skin out, or if you soak them and then you cook them open, I'm not the best guy to talk. There are better people in this panel to talk about those things than me. But this is what I have read about lectins and pulses and causing inflammation. You just soak them overnight and cook them open, like in the old, rather than doing pressure cooking. Most of 98% of lectins are gone.
Thank you, sir.
I just want to add that, whole pulses are very anti-inflammatory in nature and therefore they're very, very beneficial. So definitely no reason to avoid pulses if you have arthritis. There was a question on tamarind. I don't think tamarind has to be avoided. I think there's a myth associated with the tamarind being avoided for arthritis because tamarind typically is used as a whole food and it's used in small quantities. Ela, would you want to add something to that? There's a question on is tamarind to be avoided?
No, I think Ayurveda says I'm really not Ayurveda person, but I think in Ayurveda it is said that avoid tamarind, but I don't see any reason to avoid tamarind.
Yeah, I think even I am not an Ayurvedic person, but according to Ayurveda, all sour foods like tamarind, even lemon, they say amla should be avoided in Vata Prakriti people, that is those who have got arthritis. That is what Ayurveda says.
Sir, some persons are taking for weakness in all regular basis on glutathione. Is it advisable for a patient of arthritis?
No, no, glutathione does only a little bit of fixing of the gut, doesn't do the whole picture. So gut dysbiosis has a whole predominant reason what happens in the intercellular junction. So you got to kind of, I'll tell you my own little experience is first, the easiest way to fix gut is to fix the 6 pillars of lifestyle medicine. And of the 5 pillars, the most difficult is stress. So you fix stress, the cortisol mediated HPA axis, the gut, and then and recently I've been trying to bring our Indian thing, Ashtanga Yoga, into my clinical practice, wherein if you follow the first 5 steps, I call that, uh, I can name them, yeah, Yama, Niyama, Asana, Pranayama, Dharana. They actually fix the health. And then the Dharana, Dhyana, Samadhi, they fix the internal health. So I mean, this is all, I'm a scientist. I observe like Achyutan and then change my way I do practice, but we have it very well done. So fix all these things rather than, one little thing, fix all the 6 pillars, and that will fix a lot of gut issues. And if you don't, then now India also functional medicine tests are coming out. You can check the gut microbiome and fix. But I'm not sure about the supplements because I have a friend who lives in Rajasthan who actually is board certified in integrative and functional medicine plus family medicine. He practices in US but lives in India. He closely tells me what's available, what's coming up. Still, the supplements, you don't get the whole range to fix the gut. But predominantly for us, there is nothing better than fixing the 6 pillars of lifestyle medicine.
Thank you, sir.
Thank you, sir. There is one question. Is there enough evidence for benefits with plant-based omega-3 foods or only with supplements?
No, supplements don't do anything big. If you see in the longevity medicine, which is nothing but anti-aging plus artificial intelligence, they all talk about lifestyle and resistance training that helps people to live long. Okay, so supplements do help, but for a short time. You cannot supplement natural foods, whole food, plant-based, and all the great things the lifestyle medicine brings to the table.
Thank you, sir. Is there any question from audience? Okay. So I think now we can close the session. Uh, Before closing the session, I would like to thank our today's panel. First of all, I would like to thank Dr. Murthy Gokula sir for repeatedly emphasizing on whole person approach. I would also like to thank Dr. Ila Patak ma'am, Dr. Achyutan Ishwar sir, Dr. Suveta ma'am, and Supraja ma'am. I also would like to thank our Pan India's leadership board for providing us this wonderful platform. I also like to thank my teammates for supporting in the process of conducting this session, and also the social media team for promoting our activities. And last but not least, I would also like to thank our audiences for making this session successful. Thank you all. And with this, I declare that
Thank you so much.
The session is concluded. Thank you so much. Thank you all.